I would say 99% of the time is going to be the original recipe Botox. I do use Dysport from time to time, especially in patients who come in and sometimes ask for it. So I think if the price is too good to be true, you have to be beware of where it comes from. And there are some products that are fake, that are imported from
Hmm.
other places. There are people using veterinary products. To me, that's just an added benefit. This is all about
Right.
making somebody look better and feel better.
Who is a good candidate, and who would you say isn't a good candidate for getting that done?
Well, it's like when a patient comes in and says, "Do I need Botox?"
Welcome to Derm-It Trotter. Don't swear about skincare, where host Dr. Shannon C. Trotter, a board-certified dermatologist, sits down with fellow dermatologists and skincare experts to separate fact from fiction and simplify skincare. Let's get started.
Welcome to the Dermot Trotter Don't Swear About Skincare podcast. On today's show, we've got Dr. Gary Goldenberg. He's a board certified dermatologist recognized as one of New York's top docs. He's a leader in medical and aesthetic dermatology and appeared in more than 700 publications and media outlets. So, needless to say, he's an expert, especially in all things cosmetic. Welcome to the podcast, Gary.
Thank you so much for having me, Shannon. I'm excited to be here and I'm excited to talk to your audience.
Well, we've got a great topic here today. We're talking about neuromodulators, but most people think of the household term Botox comes to mind, especially I think for a lot of our listeners and patients out there. And I was going to be really just kind of run us through a great overview of Botox, other neuromodulators today, and talk about, what exactly is it and how does it actually work?
It's definitely a topic that I'm passionate about. Botox or vitamin Bs, I know it in my office, is something that we do day in and day out. It really is the most commonly performed cosmetic procedure globally. It's also one of the safest procedures globally, and there are different iterations of this product in the world. In US, there are multiple approved products. I tend to use the original recipe and then some of the other ones sometimes as well, but I love using Botox itself. It's really a great product. And essentially, what it does is it relaxes muscles of facial expression. So instead of looking angry or surprised or having those crow's feet when you smile, it just relaxes that area quite a bit so that you don't have those lines at rest, and you're still able to express yourself. And people know when you're mad or happy or angry. You just look a little bit softer, a little bit more relaxed, kind of like you took a vacation. And that's really the goal of any aesthetic treatment, if you ask me.
When you mention kind of other reiterations of it, I think, Botox has that household name, right? I think that's what most people think of when they think, oh, I'm going to go improve these wrinkles. Do you mind commenting a little bit on some of the other players in the market and why you might potentially use one of those? Or you feel like it's more personal preference for the injector?
I do think it's more personal preference. Most of the products that I use in my office, I would say 99% of the time is going to be the original recipe Botox. I do use Dysport from time to time, especially in patients who come in and sometimes ask for it. And some of the other products like Jeuveau and Xeomin and Doxify, which is the newest ones, I think they're fine. But in my hands, for my patient population, I really feel that Botox is the product that I choose the vast majority of the time, and it's the one that my patients expect me to use.
So if somebody's coming in to get one of these done, we kind of refer to this group of medications, neuromodulatory drugs, or some people call about neurotoxins. I wanted you to talk about the toxin part because there's probably people out there hearing like, I'm not putting that in my skin. And you already talked a little bit about the safeties. So can you explain about, like, why we think of this as, what they call the neurotoxin term, where it comes from, and then really speak to the safety of these medications?
Absolutely. I mean, look, the word comes from botulism, which really is a toxin, but it all depends on the dose. In general terms, if you think about it, all medicine is a little bit of poison or toxin, if you wish. It just depends on using it the right way, the right amount, et cetera. And Botox is very safe in a wide range of doses. Certainly, you and I will never reach the kind of dose that maybe our neurology colleagues use, or people who treat migraines or muscle spasms, etc. So the term really comes from botulism. That's where it was discovered because it stops muscles from moving. You purify it, you put it in a vial, and you let us inject maybe 30 to 50 units at a time, and it's highly effective and extremely, extremely safe.
So, when all those crazy articles were coming out, probably not too long ago, people were freaking out about getting botulism from Botox. Can you talk about what was really happening? Because I know that instilled a lot of fear in people, even in our office here, that were scared to come in and get their Botox.
Yeah, I think it's nearly impossible to get botulism from Botox unless somebody injects you with so much Botox then you actually are going to reach toxic levels. But it really has to be a lot. One of the issues, and we actually saw this in New York within the past year or so, is some people will import fake or use fake product, and it has to do with the price of the product. And I see this advertised sometimes around New York City area, and people are selling their product for less than what it cost me to buy without even marking it up at all. So I think if the price is too good to be true, you have to beware of where it comes from. And there are some products that are fake that are imported from
Hmm.
other places. There are people using veterinary products and
Wow.
injecting them in humans. This is why I always say you have to go see a board certified physician who's using a product that's FDA approved, or something that's been manufactured in an FDA approved lab. You don't want to be a case of an experiment, just to save a few bucks. So go to somebody who knows what they're doing, have experience, and they use an FDA approved product.
That's a great thing you highlight from the safety perspective, because I know some of my patients, when all that was coming out, they were really freaking out that we were literally going to give them botulism. And I was talking to them about the craziness of, yes, people using product from other countries that doesn't have the regulation oversight that we're lucky to have here. But kind of ironic too, some of my patients that said that they believe more in a natural approach to anti-aging or reversing some of those fine lines and wrinkles. They said they liked the concept of using Botox because it was naturally derived. And I said, I've never thought about it that way, but I said, what a
It's
great
definitely
perspective.
natural. It definitely comes from botulism, comes from nature.
Exactly. I said, that's a great way. I'm going to have to sell that for some of my patients that are afraid of it on that certain terms. But I thought that was a great highlight. Now, if somebody's thinking, I want to get Botox, Dysport, Xeomin, Daxxify, they're just considering, I'm looking at getting one of these. Who is a good candidate, and who would you say isn't a good candidate for getting that done?
Well, it's like when a patient comes in and says, "Do I need Botox?" The answer almost never is no. It's almost always yes. And I think we're seeing this in younger and younger patients who are getting what they're calling pre-tox, because preventing those 11s or 111s or the lines on the forehead or the crow's feet or the nasal lines, preventing those lines from happening is perhaps even more important than treating them once they occur. And what I tell patients is a wrinkle in your skin is like a wrinkle in your shirt. The more it folds onto itself, the deeper it gets and the harder it is to iron it out. So preventing it, starting when you're maybe younger, as opposed to waiting until you really have those train tracks on your face, is I think is a good idea. And I'm a case, N of one. I tell all my patients that my forehead has not moved since 2006. I've literally had Botox every 2 to 3 months, and injected into my face since 2006, and I think it really does prevent those lines from coming. I think it also improves the way your skin looks in general. It gives you what people call a Botox shine, which I think makes
Hmm.
your skin look much more beautiful, much more even toned. And look, it's a starter cosmetic procedure. It's the one that most patients probably get first, unless they've had laser hair removal. I think those two are the top two that people usually kind of try out first, and then they move on to maybe something else like laser, filler, liposuction, etc. But I think if somebody has lines at rest that can be relaxed by Botox or botulinum toxin, I think it's very good to try. Now, my approach always is, if you come in the first time, I'm going to deliberately undertreat you. I'm going to give you less than what I think you need, bring you back in 2 weeks, because it does take 2 weeks to see the full results. And then 2 weeks later, when you come in, we can always add, augment, and optimize your results. But if you're happy with how it looks, that's all that matters. I don't know how it is in your practice, but the days of making people look like they're completely stoic, no facial expression, overdone. I think those days are really over. People want a natural correction. They just want to look more relaxed, less angry, less worried, especially as they're staring at their computer screens all day long, on Zoom calls all day. It really makes a big difference.
Yeah, I would agree with you. I do think that tendency toward a more natural aesthetic or just looking like a better, refreshed version of themselves is definitely caught on. I feel like in the Midwest, we might have had that a little longer than sometimes, our colleagues practicing in the coastal regions or even down in, Florida and other parts of the states where almost having that overdone look was the desire. People wanted to look like they had something done. But I definitely feel the natural look is becoming more a part of that equation. And I think people just simply look better too with it. It's a more realistic approach because you've probably seen these trends too, especially with younger people coming in, wanting to freeze their forehead, in their 20s. And some, talk about what could be the ramifications of that over time. Do you counsel younger people about an appropriate way to use it if they're looking preventatively and maybe not going for the frozen look, or do you like to approach it a different way?
Yeah, I think in New York in general, things are sort of, understated. We call it quiet luxury. Or I think you go to California, Texas, Miami, things are still, for my taste personally, maybe a little bit overdone.
Hmm.
And I think that the sort of the understated quiet luxury look is catching on. I'll go to Dubai a couple times a year to see patients, and I even see there where everyone used to be overdone, and everyone now a lot of patients want to be sort of more subtle and have a more subtle correction. So I definitely think looking natural is the best way to go. And I always tell my patients, look, I can't make, if you're 50, I can't make you look 25.
Right.
And if I did, imagine your face is 25, but the rest of you is 50. It still doesn't look great, right?
Hmm.
So, you know, the idea of any aesthetic treatment should be to make you look the best that you can look for your age. For where you are in life, you want to just look your best. And that's really the goal here.
So if somebody's thinking about, taking that leap and getting, a neuromodulatory drug or, doing, a Botox or something else. What do when you take their history? Is there anything that you're like red flags? Sorry, you're just not going to be a good candidate or contraindication for doing it.
I mean, look, if someone's allergic to Botox, you don't want to inject it into their skin, but that's about the only contraindication that I would foresee.
Hmm.
I mean, I have had some patients who've had, by 50, they've had a dozen or so plastic surgeries, and sometimes
Hmm.
that makes me worry that their expectations are going to be so high that I or no one else will ever be able to meet those. So that patient does need more counseling. But if somebody comes in and they have, 11 lines and they have some crow's feet, they have some lines across their forehead and they want to soften them, I don't see a reason why you wouldn't be able to do it for them.
What are your thoughts on pregnancy and breastfeeding? So I actually had a colleague, a physician colleague that was breastfeeding that was really insistent on getting Botox. And I was really surprised just coming from somebody in the medical field, even looking at some of the data. I didn't know what your comfort was with that or what you tend to counsel patients on. Because I feel like that gets brought up more and more. I'm surprised because people have had it, maybe they've foregone it during pregnancy and they're finally like, I can finally do this because they're ready for it and they've missed it. How do you approach that with your patients, the whole pregnancy breastfeeding
Yeah,
kind
I
of
just don't
complex?
do it. I don't do it. I think it's not worth it. God forbid something happens,
Sure.
and it's just you don't want to be it's not that I don't want to be found guilty of it. I just wouldn't want to be responsible for something like that to happen. Is the chance of that happening low? It probably is extremely low, especially if a mother is nursing. But I wouldn't do it. It wouldn't be for me. I would just say just wait until you're done with your pregnancy and nursing, and then we can do it. A lot of my patients, when they know they're going to start trying to get pregnant, they'll come in sort of like they'll get everything they can done
Yep.
before, and then as soon as they're done nursing, they'll come back and then we'll get everything done again, just to kind of tune them up.
Yeah, I kind of take the same approach. I was a little shocked. This was an internal medicine colleague that came to see me and very insistent on doing it. And she was very disappointed that I wouldn't do it. And I said, hey, I just don't think it's worth the risk. You may find a colleague of ours that disagrees, but totally agree with you. Why take the chance? And I said, I know it's a few more months, without Botox, but I think you're going to do okay. So I think going back to,
Especially since there are other, sorry, just
go
there's
ahead.
so many other treatments that you can do while
Yeah.
you're pregnant or nursing that
Hmm.
are safe, like laser, like microneedling, like platelet-rich plasma. Those are all things that I am comfortable doing while a woman is pregnant or is nursing. And I think you can sort of kind of hold them to where they want to be with those treatments without injecting something like Botox or filler or something that has a potential of getting into the bloodstream and affecting a baby in an adverse way.
That's a really great point because I think people get so hooked on, they've been getting injected for, years or months, and to take that break really frightens them. But it's also an opportunity maybe to focus on some other cosmetic procedures that would be safe to do, and then kind of get the best of both worlds, go back to getting their neurotoxin once they're done with pregnancy and breastfeeding. So I like that angle because I think that would give people reassurance. Because sometimes, I think, when we're pregnant, we feel like, gosh, we can't do anything. And you can feel a little beat up, obviously, going through pregnancy, and it's nice to do something for yourself. So good to know there's other options that can still, look at anti-aging treatments that are going to be considered safe as well, that they could potentially pursue. Now, we talked a little bit about the natural part of Botox. I think what I wanted to ask you, maybe not referring to like Botox itself or another one of, the medications in this category, but what about, is there truly like a natural form? Because I think at one point it was all the rage on social media that like banana peel facials could give you natural Botox effects, or there's truly natural Botox that can deliver the same results as what you're injecting in office. But I'm passing the baton to you, Gary, to set the record straight about what really exists and if there really is a substitute out there.
I mean, look, I don't think that there is anything that does the same as Botox. I don't think there is another injectable or topical that's going to prevent your muscles from moving so that you're not wrinkling your skin, you're not getting that deep wrinkle every time you make an expression. So I think from that perspective, I think the answer is no. However, I think there are other options for treatments like laser, like skin tightening, like platelet-rich plasma. For somebody who doesn't want to inject something into their skin, it's certainly something that you could consider. But I think it's very important to explain that what what Botox does compared to all of the other modalities is very different because there isn't another treatment that can make your muscles relax. So it treats the wrinkles that you have now and it prevents wrinkles from happening down the road. I'm not aware of anything else, maybe you are, Shannon, that does the same thing. That's why I think Botox works very well with all of the other cosmetic procedures that we do.
No, I agree with you. I think it's a wonderful complementary aspect to the things we can offer. And then what I do like is there can be a preventative aspect of it. Too often people are coming in late in the game where they've already developed those fine lines and wrinkling. And I know there can be some controversy and people discuss, the ethics of when do we offer these types of things and how do we treat patients appropriately. But I do think there's a role for it in prevention for the right patient and realistic expectations, and trying to offer them more this natural aesthetic that they can potentially get ahead of the game. And that's, I think we're all healthcare focused, right? We're trying to work on prevention. Yes, this is more on the cosmetic side, but I think it falls in line with that nicely, that you can have a conversation with the patient and really talk with them about, hey, this is the benefit. We can improve what you have potentially right now, but the other plus side is we're really working to preserve your face and prevent some of this wrinkling in the future, especially if you're going to be bothered by it. So I wholeheartedly agree with you. Love the prevention
Yeah.
piece.
And look, I think there's a lot of evidence that injecting Botox actually helps with mental health. There are several studies that show that it's good for depression, and it's not just about looking better and seeing a better image of yourself. It's actually been proven that if you frown less, you feel less sad and less angry and less depressed. So that's why, if you're having a bad day, they say to smile
Hmm.
because it does help, right? And I think there are some studies that clearly show that biofeedback that to your brain, if you can't frown as much, if you can't wrinkle your forehead and the growl as much, actually does help with depression and other mental health issues. But that's not why we're here, right? That's, to me, that's just an added benefit. This is all about
Right.
making somebody look better and feel better. And look, I'm in private practice, you're in private practice. We don't have to treat everyone that comes through our door, and not everyone has to come and see us. It's a choice, and you could practice the way that you see fit. I think as long as you're staying within the safety parameters of what the FDA has outlined, I think that's fine.
One kind of burning question I have, because you obviously been doing this for a while and have great expertise in this area. And for those of us that have started using it with patients or even noticed on ourselves, I've had the residents practice on me for years, or occasionally if we're doing some trainings here in the office. So I feel like sometimes my use of Botox or Dysport, the two that we mainly have, we've had also Daxify as well, has been intermittent. But one thing I have noticed, and I was curious if you see this trend with some patients, that I've noticed for me sometimes Dysport seems to last longer, and I've always wondered, is this more about the molecule, or people talk about Botox resistance, or how the molecules are wrapped a little bit differently, and maybe there's antibody formation. I wanted to get your thoughts on that, because that is something one of our patients asked me the other day. She said, it just, Botox doesn't work for me anymore. I had to go to something else, and I wanted to get your thoughts on what the data really shows, or what you've seen in your own clinical experience regarding that.
Yeah, I think with Dysport, I think that the conversation people use when it first came out is that it works faster and it lasts longer. And I think the reason for that is that we would initially, at least I was trained to use 3 units of Dysport as an equivalence of 1 unit of
Hmm.
Botox.
Same for
And
me.
it turns
Same.
out probably 2.5 units of Dysport is an equivalence of 1 unit of Botox.
Okay.
So if you're injecting more,
Hmm.
you're going to get a faster result and you are going to get more longevity. In fact, when Daxxify was just in studies, there were several studies done with Botox. If you double the dose, especially in the glabella, it
Hmm.
can last for up to 6 months.
Wow.
Now the caveat of that is if you drop somebody's eyebrow, you inject too
Hmm.
much, you really overfreeze them, it's going to last for 6 months. So when I counsel my patients, I tell them everything's a bell curve. For most patients, it's about 3 months, but the bell curve has two sides. So some patients, it's a little bit underwhelming. Maybe it's really only 2.5 months. And then for some patients, it's 3.5 to 4 months. It really is patient dependent. Depends on how fast your metabolism is, how expressive your face is, what kind of work you're in. Are you constantly looking at a screen and scowling, or are
Hmm.
you, out and about in a business where people are more maybe more happy and they're not looking at a screen all day? I think all of these things make a difference. There are some patients who can become resistant, and I've had patients resistant to every single botulinum
Wow.
toxin that you could imagine. So I do a washout for them. I tell them no
Okay.
botulinum toxin for 6 to 12 months, and then we start one at a time and figure out which one is going to work for them. The antibody piece that you brought up,
Mhm.
I think whether they're present or not is less relevant of whether they are clinically relevant.
Makes sense.
And, I'm a Botox user. I've been since 2006. It's the product I probably injected into my forehead maybe 99% of the time. I do use Dysport every now and again if it's available. And I have not seen a difference. And I think for majority of my patients, I think it's highly effective, regardless of how long you've been using it.
No, I think that's a great explanation, because sometimes I did wonder about the conversion factor and just am I utterly getting more? And again, it's so intermittent and floating back and forth, because a lot of times it's what's available and what we're doing for training at the time. But with consistency, I like to see how that works. And I like the idea of a little more, but you're right. We don't want to drop a brow for 6 months. That may not be worth the price of a longer time frame of it working for us. So,
And,
if,
and
go
look, when
ahead.
patients ask me why I choose one product versus another,
Yeah.
I tell them, I say, look, this is what works best in my hands.
Hmm.
If you go somewhere else, they may offer you a different product because that dermatologist, maybe this is the product that works best in their hands. I know what works best for me, and that's kind of what I stick with.
So, what do you think works best then for patients once you've done their Botox? What are sort of your do's and don'ts? I think the big one I get asked all the time, is it really true I can't fly on a plane? I'm getting ready to head out, like literally in 4 hours to catch a flight, and they just popped in to get their Botox done. How do you answer those questions that come up?
Yeah, I used to go crazy. I used to say, don't go shoe shopping, don't do this, don't do that. And now I tell them, look, you can do whatever you want afterwards. The only thing is if you exert yourself or bend down, like do yoga for a long period of time and go lift weights or go for a long run. If I was going to give you a tiny boo boo, that boo boo may be slightly larger because there's more blood pooling in the area.
Hmm.
But I really don't believe in any of these other instructions. In fact, I have a fairly large international presence in my office. Patients fly in, we'll do Botox fillers, laser, PRP, hair treatments, whatever you have. They might be getting on the plane that same day, and I don't think it's an issue. So I'm in the camp of if you don't care about getting a bruise, go about your business. If you don't want to get a bruise, ice and try not to bend down for the next 24 hours.
I like the simplicity of that. That's great. Are there any other do's or don'ts you tell your patients then?
Don't come back. Don't forget to come back. That's the biggest. That's the biggest do's and don't. It does only last for 3 months, and I think to your point with patients thinking they're getting resistant. as we age, especially once we're sort of in the middle age, in the meaty part of the bell curve in the middle age, where I am, I think our muscles tend to get stronger and stronger. So you may require more Botox as your muscles get stronger. So I don't think that's really an issue. And I think there are some gender differences. I definitely think that men tend to require more Botox, especially if they want to be more frozen. But I think that that's really patient dependent. There are some women with really, really strong facial muscles
Right.
who, need 70, 80 units of Botox every 2.5 to 3 months because that's what they require, for a perfect correction. So I think it really is patient dependent, and you can't do the same treatment for every patient,
Hmm.
and then you can't do the same treatment every time they come in because their muscles are going to change. As one muscle is relaxing, maybe another one picks up the slack. So I think I remember when I first started, I had paper charts. I used to take super diligent notes to like a millimeter of where I injected somebody. And now I just put an amount. I inject it in glabella, forehead, crow's feet, nasalis, whatever, because I know that when they come back again, I'm going to have to retailor their treatment to what they look like that day. It's not necessarily stable. We're always changing, and our needs are always going to be changing.
I love that you point that out because I do think, especially working with some of the residents or providers listening, a lot of times they just want to do the standard thing every time somebody comes back in. They'll look at that previous note. And I'm surprised because, just like you said, depending upon metabolism, expression, little asymmetry that we all have with our face and the utilization of our muscles, you might need a little bit more in one area, a little less in another. Or, yes, the muscles get stronger, but maybe the left side's a little stronger than the right over time, and it's broken down a little bit differently, from side to side or in different areas. So I think that's a good clinical pearl that you highlight to really treat the patient when they come in based on what movement they have and what your goal is, and not just what you have in the note previously.
Look, I,
So
I think if you really examine someone's face, most people are asymmetric.
yes.
And I think making sure that you point that out is very, very important. And I think the other misnomers, like everyone thinks, oh, Botox is so easy. It's so easy to do it. Well, it's easy until you screw up, until you drop an eyebrow or someone has a crooked lip. So you really want to go to somebody who's professional, who's done it a few times, and you're not just there, for practice. Because I think it's a lot easier if you ask me, it's a lot easier to scrub Botox than it is a laser treatment or even microneedling.
So in our final minutes here, is there anything else you really want patients to know if they're thinking about getting this done that we haven't talked about, like any key things that you want to bring up for them?
Yeah, I think it's really important to kind of go low and slow. Start with just, you don't need to get a full correction on your first visit. Start with maybe 50, 75% correction, see how you like it. And you can always come in 2 weeks to get an optimization of your treatment. But one caveat that I always turn these patients away. If somebody comes in and says, I just want this area treated. I don't want my forehead. I don't want my crow's feet. I don't want my nasalis treated. I just want my glabella. I always tell them it's going to be a tell. Like in poker, there's a tell. So this area won't move. And then the rest of your face is going to move and look the same. And it's going to look so unnatural. So I always counsel my patients, we either do a correction or we don't do it at all. Because those are both okay. But having a partial correction, I think it just looks different. And I think people notice it.
Well, this is fascinating. I think for a lot of our listeners out there, it's probably opened their eyes to the pluses and minuses and the questions they're thinking about. And I agree with you. It's kind of the gateway cosmetic procedure because often I feel like once people are comfortable with the thought of doing this, definitely leads to other things down the line. And I'm surprised at how many people absolutely love it that maybe were fearful in the beginning or it wasn't their thing they thought initially. And I always tease, if you do this, it's probably going to be a little addictive. You're probably going to come back for more, like you mentioned earlier.
Yes, for sure.
Well, Gary, thank you so much for coming on the podcast. This has been great to have a nice overview so people understand neurotoxins more and kind of what they can do for their skin and if they're potentially good candidates and kind of the approach that we take with these in dermatology. So thanks so much for coming on the podcast. I appreciate it.
Thank you so much for having me.
And stay tuned for the next episode of Dermatrotter Don't Swear About Skincare.
Thanks for listening to Derm-It Trotter. For more about skincare, visit dermittrotter.com. Don't forget to subscribe, leave a review, and share this podcast with anyone who needs a little skincare sanity. Until next time, stay skin smart.